this is my audience. And
Wait. Okay.
okay, and I am doing my presentation on MRSA, which is methicillin-resistant Staphylococcus aureus. I might have pronounced that completely wrong. So there's a brief history of MRSA, which is it was first observed in the UK about 1 year of using the antibiotic methicillin to treat the staph infection. The first outbreak of healthcare acquired MRSA was seen in the Boston Hospital in 1968. At that point, MRSA was only seen in the healthcare setting, but community acquired MRSA was first seen in individuals who injected drugs using single needles or IVs in the early 1980s. So MRSA is gram-positive. It is coccal shaped, and it is a fallative anaerobic bacterium. And many common antibiotics do not kill it. The biofilm is an example of MRSA that can be found on an implant device, such as an IV catheter. This is mainly because MRSA biofilm attacks the body and creates more of an antibiotic resistant than free living cells in the body. So that shows a picture of what MRSA looks like underneath a scanning electron microscope. The purple color is due to the virus being gram-positive, and this microscope uses 10,000 zoom, so you can observe the shape of the virus. So this photo shows the biofilm on an individual's artificial heart prosthesis. The port of entry for MRSA was the IV catheter, and then the infection settled in the heart, as MRSA can cause toxicity. They can cause severe infections and possibly death if left untreated. Sepsis is a common toxicity of MRSA, and sepsis is a deadly response to an infection in the body. An example of this type of deadly infection is endocarditis. So having an IV in your arm or anywhere in your body can increase the chance of having MRSA, which increases the chance of having the endocarditis. This becomes a fatal vicious circle. Endocarditis is an infection in the heart which is caused by MRSA entering the bloodstream. This damages the heart valves, and the solution to this is immediate IV antibiotics. And the individual that would have this would be very ill. So MRSA is very antibiotic resistant. It is resistant to all beta-lactam antibiotics, which includes penicillin, carbapens, fluoxetine, and cephalosporins. Some resistance is to tricholytic glycopeptide antibiotics, and at times MRSA can even be resistant to vancomycin, which is more of a recent development. Well, there are two types of MRSA. There is the community acquired, which you would get out in the community in an everyday setting. Like you could pick it up from a gym or even like a fast food restaurant or any type of restaurant really. And then there is the healthcare acquired type, which comes from a healthcare setting. So such as like a nursing home, dialysis center, hospital. So this shows how MRSA can enter the skin. Like for example, you sit down on a bench at your local gym, you have a small cut maybe on your leg. Well, your skin becomes the port of entry, then it infects the area. The pus comes along, and the little purple things are the MRSA bacteria. And then it just shows how the infection embeds into the skin. And this is an example of a MRSA wound in the foot. As you can see, the area surrounding the foot is red, swollen, I would imagine painful. yeah, it just doesn't look good. So the healthcare acquired MRSA is the second kind. This would come from a hospital, nursing care center, dialysis center, anything like that. This type of MRSA can come from medical devices, such as an IV catheter, indwelling urinary catheter, indwelling ports like a dialysis port, improperly sterilized equipment, infected surfaces like a bed rail, or infected wounds. So the photo shows a reversible sign showing if equipment is clean or biohazard, and using this type of signage in a medical facility can help to cut down on the occurrence of MRSA. As you know, you can flip-flop the sign. So proper hand hygiene, we all know about it, but it's good to go over it, especially when talking about MRSA or this time of the year. So to wash the hands correctly, we're going to start with warm water. Cold water can be used if absolutely that's the only thing you have. We're going to use the soap, rub your hands together. The most important step is the actual scrubbing part, ensuring that the front, back, and in between the fingers are all getting scrubbed, and underneath the fingernails for at least 20 seconds. Rinse the hands, dry the hands, and use a paper towel. If no paper towels are available, allow your hands to air dry. If soap and water is not available, you can use a 60% alcohol-based hand rub like Purell. And then when using the hand-based cleaner, you want to ensure that your hands are rubbed together the same way as if you were using soap and water, and then rub the sanitizer into the skin until it is dry. And this photo just shows the different things that you could catch if your hands are not clean, or that you could possibly pass on to like a patient or a family member or anyone. So you want to alcohol rub or wash before and after every patient that you would see if you're in a healthcare setting. So basic sanitation is a way to prevent the community MRSA. You want to ensure that laundry is done at least 160 degrees in hot water, and that a dryer would at least reach 180 degrees Fahrenheit. Using an oxygenated laundry detergent or another type of laundry detergent that can kill MRSA, such as the Lysol laundry sanitizer. And Lysol spray will kill MRSA on items that you cannot put in the washer, but you must ensure that the directions are followed, and Lysol must have a wet contact time of 10 minutes. And then you can use bleach as well, using a 1:10 ratio on hard surfaces such as floors, benches, restrooms, all that good stuff. Next is cellulitis, which can also be caused by community MRSA as well, as that is genetically different from the healthcare strands. Individuals with community MRSA are usually younger in age, and the strand is US 300 and 400. And one of the main differences with it is the Paxton Valentine leukocorn gene. This gene causes the necrosinizing cytotoxin, which allows the MRSA to invade into the tissues. And this type of MRSA is in the skin, and it's a soft tissue infection. And it appears as boils, pimples, abscesses, or cellulitis. And a lot of the time it can be confused with a spider bite as well, but it's not a spider bite. So risk factors for the community type of MRSA is athletes, if you attend daycare, lived in crowded or close conditions like barracks, prison, that type of stuff, skin abrasions, and poor hygiene. Because the transmission for this is person to person. So I touch your skin, you have a little sore on it, I have a little sore, and that's all it can really take. And treatment depends on the individual wound and the severity of the infection. Most of the time, the simple skin infections can be treated at the doctor's office with sterile drainage and without antibiotics, as long as the dressings are changed as the doctor prescribes them. But if it is a severe type of skin infection, then antibiotics and IV antibiotics could even be used on an outpatient basis. So this is a photo of a healthcare associated MRSA. This individual here had a hernia surgery and ended up with some complications, and then spent about 4 weeks in ICU as the abdominal wound became open. This type of MRSA usually will affect older individuals that live in long-term care facilities or receive dialysis. The strain type is the US 100 and 200, and this type of MRSA rarely carries that PVL gene, which causes the soft tissue and skin infections. Healthcare MRSA is more responsible for ammonia, bloodstream infections, sepsis, surgical site infections, and sometimes death. So this photo or slide here kind of shows how an IV works and how it goes into the skin, and then how that port of entry can actually cause the MRSA infection. And because there's trauma done to the surrounding skin as it goes into here, causing, over here is like an IV. These are examples of IVs that became infected with the MRSA virus. So treatment for the healthcare MRSA is different than the community MRSA, because these individuals are sicker and more complex to treat. Most of the time, the drug antibiotic vancomycin is commonly used. This drug is given through an IV, and it has a pretty good effective rate. If the MRSA is very severe, they will use a drug called cephalin. Cephalin would be given to very ill individuals who might have the ammonia or ventilator ammonia. Vancomycin and cephalin prevent the infections from constructing new cell walls, and that stops the MRSA from reproducing. So an example for treatment of an individual using vancomycin, they have to have normal kidney function to use vaso, because one of the side effects of it can cause acute kidney injury. And they would use 15 to 20 milligrams for every kilogram, given at about 8 to 12 hours. And it runs for at least an hour through the IV. And the rate for success using VACO is between 60 and 80%. And then the trough levels must be monitored to ensure the correct levels of the drug are in the body to fight the infection. Because if it's not, then the pharmacist has to readjust the amount that the individual would receive. And the photo just kind of shows how the MRSA gets in there versus the healthy Avilois, and the ammonia type of Avilois is what is seen there. So thank you for your time and listening. And for the most recent type of MRSA updates, you would contact your doctor, or information can be found at the CDC's website.